everyone, myself Dr. Rakshita. I am currently working as IVF specialist and center head at Indira IVF Hisar. Today we are going to discuss about assisted reproductive technology. Before that, I would like to highlight the problem of infertility. And as I studied the statistics, it was quite alarming to see how many millions of couples are affected by this problem. And if we look at the worldwide statistics data, then at least 8 to 10% of the couples are infertile worldwide. That means at least 60 to 80 million of the couples are infertile. Also, if we look at the statistics of India, then India stands about 25% of this data. That means in India itself, at least 20 million of the couples are infertile. If I talk in general terms, then one in every four couple is infertile in India and other developing countries. So this statistics is quite alarming, and this raises the need for many techniques and technologies. And the techniques that are used to treat the infertile couples are known as assisted reproductive technology. So today we hear a lot of terminologies like IVF, that is in vitro fertilization, ICSI, that is intracytoplasmic sperm injection, and cryopreservation of eggs, sperms, and gametes, and a lot more terminology that are associated with these treatments. So let us discuss the problem of infertility. When do we call a couple as infertile? If a married couple has been trying to conceive for more than a year without using any contraceptive methods and have not been able to achieve pregnancy in a year, then that couple is known as infertile, or this is termed as primary infertility. But we do see many couples who have conceived once, they do have children before, but after one conception, they are not able to conceive second time. So these couples are known as suffering from secondary infertility. So these infertile couples need the treatment, and these treatments are known as assisted reproductive technology. Now, what all problems are there that these infertile couples face, and when do they need this treatment? Infertility is a disease which consists of many problems, many factors, which can be seen in the male partner as well as the female partner. The problems in the female partner that can arise or that can lead to the need of the IVF or ICSI or any other method are like tubal factors. That means if the fallopian tubes of a female partner are blocked or not functioning properly or twisted or tortuous, in these cases the process of fertilization that occurs in the fallopian tube is not occurring, and that is why the patient is not able to conceive naturally. The other factors may include like some diseases or infections of fallopian tubes, uterus, and ovaries, or deficiency of eggs in the ovaries, which is known as low AMH or decreased ovarian reserve, or any diseases which are affecting the efficacy of the ovarian function, like any carcinomas or infections, oophorytis, or any other condition like endometriosis, endometriomas, and polycystic ovarian diseases. These all diseases lead to problems in the egg formation in the ovaries, and that is why a couple is not able to conceive. Some other problems are also there which can lead to infertility, and these problems may be seen in uterine function, leading to fibroids or thin endometrium or endometritis, or infections like tuberculosis, which are very common in our country. These problems lead to infertility in female partners. Nowadays, there is a rise in carcinomas or cancers as well, and because of the treatment of these cancers, which are very gonadotoxic or toxic to the gametes, may lead to infertility. And also, to preserve the fertility of these young couples or young patients who are undergoing treatment for cancer, we do need ARTs, that is, assisted reproductive technologies like cryopreservation of the eggs or sperms or the ovaries. Other problems that may need IVF are like problems in male partner, like azoospermia, that is nil count of sperms, or decreased motility of the sperms, decreased count, or morphological abnormalities in the sperms, or any obstruction in the vas leading to azoospermia, or any other factor that may lead to decreased potentiality of the sperms to fertilize the egg. There may be other problems as well, like infection of the testes or genital problems of the testes, or also occurrence of many genetic diseases in the family that may pass on to next generation, and therefore there may be a need of pre-implantation or prenatal genetic diagnosis or testing, which may lead to a need of ARTs. So the scope of ARTs has increased a lot these days. Even the couples who are not infertile, who are not as such able to conceive pregnancy, but who are conceiving babies with some genetic disorders, may also take the help of ARTs so that they can detect the diseases in the embryos itself, and then get the healthy embryos transferred or implanted in uterus, and then get a healthy baby and a healthy pregnancy. So, in ART, let me tell you what is the process of ART, how do we go ahead with ART, and what all techniques are done. First of all, assisted reproductive technology is a technology which includes the treatment of infertile couple by taking out the eggs from the ovaries of the female and then fertilizing the eggs with the sperms in the genetic laboratory or the embryo lab. And then, when the embryos have formed in the incubator in the lab, then we transfer those embryos into the uterus of the female partner. So, like this, the process of IVF or in vitro fertilization occurs, and lot many steps are included in this process. First of all, when patients come to us, the first step that occurs is ovarian stimulation. Now, many people come to me after they have taken ovulation induction or many other drugs to increase the size of the egg. But in vitro fertilization or in ICSI or in ART, what we do is we increase the size of all the eggs by giving them gonadotropins and hormonal injections. And when these eggs have reached proper size, or when we can say that the oocytes have matured inside those follicles, that is the time when we take the patient for oocyte retrieval. This procedure is done under ultrasound guidance transvaginally, and then we take out these eggs, we study them, we find out a lot of problems in those eggs in couples who had no reason as such for infertility, which we call as unexplained infertility. So when we study these eggs, we find out a lot of problems in zona pellucida or inside the oocyte, in the cytoplasm or mitochondria or smooth endoplasmic reticulum, or any other changes, or in the shape and size and morphology of the oocytes. And then we get to know what the problem has been. When we select the mature oocytes from these eggs, in those eggs we fertilize or we inject the sperms. Earlier, a procedure was used, and even now in some labs they are using this procedure, in which in a dish, one or two oocytes were taken, and then sperms were left in that dish to fertilize naturally these eggs. But in this, the cases which had thick covering of the eggs, the sperms were not able to fertilize them, and that is why we went ahead with the terminology called as ICSI, that is intracytoplasmic sperm injection. That means we are injecting the good nicely selected sperms which are morphologically good and which have good tail and no defects in head or neck or tail. Those sperms we are injecting into the eggs directly by the help of injections, and this is known as ICSI, and we are increasing the probability of fertilization and also bypassing the zona pellucida or the covering of the egg. So after this process, we let the eggs incubate in a media. That media is very well maintained, pH balanced, and the environment of the lab is maintained and everything is maintained. And then these embryos are let to incubate. We check after 3 days what grading has occurred, what kind of embryos have formed, what cell stage they are in. Usually, we find 6 to 8 cells on day 3, and if we let these embryos to grow further, then on day 5th of incubation, we get the blastocyst. So, blastocyst is a stage of the embryo in which there is a cavity filled with some fluid, and there is a outer covering of the cells. There is a fetal pole kind of thing, which up area which will form the baby later on, and the outside covering has tophoectoderm. And this blastocyst is the stage which we like. This is known as the blastocyst culture, and because of this technology today, the success rate of IVF has increased drastically. We have been able to reach up to 80% success rates, and the major role that has played in this success rate is the blastocyst culture. Now, after that, either we do fresh embryo transfers, or we let these embryos be frozen in the lab and then we transfer it later on. Some couples can choose to freeze these embryos for later purpose after 1 year, 2 year, 3 year, as per need may be. And that is why many couples are electing to form embryos and freeze them if they are not ready to get pregnant because of their career or because of any other problems. Also, we are helping the couples who are undergoing the chemotherapy or any other therapy, and in this way, they can get pregnant in later stage. So, this is the total process of ART, and this includes the oocyte retrieval, the cryopreservation, the preservation of the eggs, the preservation of the sperms. Like, we have many couples who have their husbands staying very far away, or in professions like in Navy or in Air Force. They don't come so often, or they might be undergoing some treatment which might lead to infertility later on. Those couples are opting for freezing their sperms, freezing their eggs, or freezing their embryos. Now, the other group of infertile couples in which we can help through ART are those who do not have eggs, or whose eggs or sperms are damaged a lot. So, in these couple, we can use the eggs of other women or sperms of other women. So, that is termed as egg donation or sperm donation or embryo donation. So these are the techniques that we are using in ART. There is also a technique known as PGS, which can help those couples, in which we are testing the embryos for any specific diseases present in the family, or any other disease like thalassemia, sickle cell anemia, or CFTR gene presentation, or any other diseases, and then we are implanting or transferring the healthy tested embryos. So I hope you like this information. If you need any more answers, or if you have any more queries and would like to know anything about assisted reproductive technologies that we are using at Indira IVF, you can call the number given below. Thank you very much.